The pandemic has taken so many lives, about 5.3 million worldwide so far. It's left so many families upended and changed our working world and education system. It's taken up our attention, contributed to our fears, and led to a remarkable shared scientific triumph, all in the relatively short span of 2 years. It's been a global equalizer, impacting everyone across the world, and it's had a tremendous impact on one of our major pillars, our senior program. Now we'll talk about COVID-19, what's next, with our guest, Dr. Peter Hotez, Dean of the National School of Tropical Medicine at Baylor College of Medicine. I invite back to conduct this conversation CEO Dan Mariaschin. Dan, take it away.
Thank you very much, Chuck. In 2017, Dr. Hotez was presented with the B'nai B'rith Distinguished Achievement Award for his instrumental work tackling neglected tropical diseases and vaccine development. The award honors the accomplishments of key community and corporate leaders from around the world and their commitment to improving the lives of the individuals that they serve. Previously, Dr. Hotez was chosen by the White House and U.S. State Department as the United States Science Envoy, where he focused on establishing science diplomacy initiatives for the U.S., the Middle East, and North Africa. In these pandemic times, Dr. Hotez is a frequent contributor to pandemic and vaccine-related discussions on TV, in print, and across social media. It's especially meaningful to have him here to discuss COVID. B'nai B'rith is the largest national Jewish sponsor of affordable housing for seniors, and as such, we're very involved in COVID safety. Our 38 buildings are home to some 5,000 seniors, each in their own apartments. Residents in each building rely on incredible programming and amenities that make B'nai B'rith housing properties unique. Most of the buildings participated in the CDC Pharmacy Partnership or with their local health departments to hold COVID-19 vaccine clinics for residents and staff in the buildings in January and February of 2021. And most of our buildings have held flu and booster shot clinics this fall. Throughout the pandemic, B'nai B'rith has worked with all the buildings to get masks for residents and staff, sometimes through donations and some from the Department of Health and Human Services, in addition to securing other supplies. Dr. Hotez joined us at the beginning of the year on our Conversations virtual content series to talk about the pandemic. And now we welcome him back and say thank you, Peter, for being with us again. Welcome.
Well, thank you, Dan. It's of mixed feelings that I'm back here. Of course, I love working with you and B'nai B'rith, and always delighted to speak to my friends and colleagues with B'nai B'rith. But usually when I'm being asked to come and speak, it's generally because there's a new problem, and it looks like that's the case as well. But I'm looking forward to getting through this with you and kind of talking through what are some of my big concerns. Before we do that, I was just thinking back when B'nai B'rith and you honored me back in 2017, and it was primarily speaking about our vaccines for the world's poorest people. And I think I might have mentioned back in 2017 as a sidebar that we were also working on vaccines for something called coronaviruses, because they were orphaned just like our vaccines for neglected diseases were. And you were like, yeah, sure, okay. And I think that's the way the world thought of our coronavirus vaccine program. And then obviously when the COVID-19 sequence came online in January of 2020, we were able to pivot on that, and maybe we could talk a little more about it this afternoon. But now our COVID vaccine we expect to be released for emergency use in India this week, maybe next week, but certainly before the end of the year. And it's a different type of COVID vaccine, one to vaccinate the world's poorest countries, just like our other vaccines. And the theme of my remarks back in 2017 were around this concept of repairing the world and tikkun olam, and particularly this concept of science tikkun. And I think, definitely this low cost recombinant protein COVID vaccine for the world hopefully will be fitting in that spirit. So So on the one hand, thrilled to see you, Dan, and my brothers and sisters with B'nai B'rith. On the other hand, it's with mixed feelings because of all the sadness that's about to come with these next Delta and Omicron waves.
Yeah, I want to talk about that first, of course. A lot has happened since we spoke earlier this year. As Chuck said, we've now seen about 5.3 million deaths around the world, 800,000 here in the United States. Gruesome numbers. Let's start with the newest COVID developments. Tell us about the Omicron variant. Will there always be new variants? I mean, are we now in a pattern here? And what do you say to people who are terrified that this will never end? And what do you say to people who may be resuming possibly unsafe activities because they've just had enough? I mean, I hear this all the time, and you do, I'm sure, everybody does, about cabin fever. They've had it, and it's 20 months. What do you tell them?
Well, Dan, even I've had enough. I was hoping to get a little bit of a break over December. I have my adult daughter and oldest daughter and oldest son coming in to visit, and we just canceled my visit for my mother-in-law to come down from New Jersey to be with us because of my concerns for her health because of Omicron. The big picture is, as long as we refuse to vaccinate the world, especially the Southern Hemisphere, we'll continue to have new variants. Alpha arose, you remember the Alpha variant, the B.1.1.7 out of the UK in 2020, that arose out of an unvaccinated population in Southern England. And then Delta arose a few months later in early 2021 out of an unvaccinated population in India. And I've been saying this to anyone who will listen, well, what do we think is going to happen when you allow the entire African continent to remain unvaccinated, which is what has happened because we didn't get the support for our low-cost vaccine for the world. And sure enough, right on cue, the Omicron variant arose. And so as long as we refuse to vaccinate the Southern Hemisphere, which for all practical purposes is what's happened, we'll continue to have variants. We do not have to live this way. If we can vaccinate the world, I still believe we can vaccinate our way out of this pandemic, but there just doesn't seem to be the global mechanisms in place to make that happen. As much as we're trying to do it, we're just not getting the help that we need from the US government or from the G7 countries. We're still very much on our own. We're doing bilateral negotiations between our lab in Texas and with India and Bangladesh and Indonesia and now Botswana, and it's happening, but it could have been far more accelerated had we had that global support. Now, what's going to happen? We've got there are three components to what's happening in the United States, and it's really not too different in Israel or in Europe or most of the world. I think so let's break it down to the three big components that I see. First, Delta. Delta's not gone away. It's still here, and many of us were predicting a pretty serious Delta surge over the winter, similar to the one that occurred here in Texas and in the southern United States over the summer. And then we predicted yet another Delta wave, because it's really interesting when you look at that Delta wave in the summer in Texas and the southern US, it looks identical almost to the peak that happened a year ago, a different variant, but same timing pattern. So based on that, we predicted another big Delta wave, and that's happening. And so if you're unvaccinated, you can be certain that that Delta is going to be a huge problem for you, and it's going to sweep across the United States. Now, superimposed on that is this Omicron variant that arose out of Southern Africa, Botswana, and South Africa, and then and really is now hitting the UK hard. In the past, when we've had the variants of concern arise out of England, we've usually had 4 to 6 months before it picked up in the US. So that was true of Alpha, that was true of Delta. So on that basis, I would have predicted, yeah, Omicron's going to hit us, but not for a few more weeks. We'll have to the end of January, February. No such luck. It's here now, and it looks like it's going to peak around Christmas, around December 25th, 26th. So that's the reality, and it is highly transmissible, more than even Delta. I mean, Alpha was more transmissible than the original lineage. Delta was more transmissible than Alpha, and now Omicron is more transmissible than Delta. So with each new variant that arises, it's more transmissible. And that's why you're seeing a few patterns emerge. That's why you're seeing the NFL and the NBA, when in the past we've kind of gotten through it. Now I don't know how we get through these next few weeks. I think there's just too many people who are going to get infected with Omicron because it's so highly transmissible. And almost everybody by now has heard about someone who's gotten fully vaccinated, even boosted, and had breakthrough symptomatic illness. And that's borne out by the immune escape properties of this Omicron variant that you've been hearing about with all the mutations in the spike protein. And we just got in on Friday some new data on Imperial College London. And I think this is very instructive. So let me just take you through it very quickly, which is that if you've only gotten 2 doses of either of the mRNA vaccines, it looks like those 2 doses, the immunity wanes pretty quickly. If you've only gotten 2 doses, you basically have close to zero protection against symptomatic Omicron. You have a little bit of protection against hospitalization and severe illness. So the message that we're trying to send across the country, and I'm sure President Biden in his remarks on Tuesday will emphasize is get your booster. And by getting your booster, what that does is give you a 30 to 40-fold rise in your virus neutralizing antibody to restore that protection. And if we were only concerned about Delta, I feel pretty good about what that third immunization does, because I've been saying all year that it's a 3-dose vaccine. It's not 1 and done and 2 and done, but it could be 3 and done. The problem in the one part that really upsets me is that it looks as though the immunity from the third immunization, the booster, is not as robust as we'd hoped, particularly when you're a few months out from your booster. So if you got your booster in, say, September and October, you are at risk for breakthrough symptomatic infection, because when you're more than a couple of months out, it only protects about 30 to 40% against symptomatic infection, so not very high. What it does do, it still preserves the protection against severe illness and hospitalization, around 80%. So that's good news. So we were hoping not to see a lot of severe illness breaking through if you got the third immunization, but we're going to see a lot of people getting symptomatic COVID. And I know that's very distressing for a lot of people. But I think the biggest concern then about that is going to be as follows. So what you're going to have, in the coming weeks is, number one, a lot of the unvaccinated still piling into hospitals with Delta. You're going to have unvaccinated going into hospital with Omicron, and you'll have a few that are fully vaccinated and boosted also hospitalized with Omicron. But the big impact that I see is going to be on the healthcare workers. That even though they've gotten that third immunization and they're not going to get very sick, what happens if they're a few months out from their boosters and they get symptomatic COVID? It means they're going to be at home, and that's going to be the big stress on the system. That a lot of unvaccinated piling into hospitals, and a lot of the healthcare workforce knocked out, not because they're severely ill, but ill enough to be at home and not coming into work. So as we've been reporting all year, there's already been a lot of stress on the healthcare system. Now, I think it's going to be strained as it's never before because of so many absences with breakthrough COVID. And so what are some of the innovative things that we can do about it? So this is going to be the big issue, is that I call it a 1, 2, 3 punch. Punch 1, Delta; punch 2, Omicron; but punch 3 is the healthcare workforce knocked out because they're sick at home with COVID. And presumably the Biden administration is concerned enough that that's going to be, I think, a big topic of emphasis on Tuesday, how you manage that 1, 2, 3 punch, especially number three. And I've made some recommendations to the White House, as have some colleagues, and we can talk about that as well.
Well, we're meeting here virtually, but we have many people who've joined us from all over the world, and I think you could hear a pin drop. That's how closely people were just listening to what you just said about Omicron. The vaccines were developed with incredible speed, as we understand it. Talk about the global effort of the science community to create these vaccines. I mean, you've done all this work for India, for example. How does that work? Because we don't really see that. We're hearing reports about what affects us day to day. But what's the community doing? The science community.
Yeah, I mean the science, community, I think a big emphasis when the pandemic started was I think the science policy community never realized the scope and magnitude of this pandemic, and the thinking was probably that this could be contained provided we could rapidly immunize the population. So the whole emphasis on the vaccine program, whether it was Operation Warp Speed or equivalent programs coming out of Europe, was to rapidly immunize with a new technology like RNA or adenovirus so that you could contain the epidemic and prevent it from becoming a pandemic. And I understand the basis of that. And we wound up getting very interesting vaccines. For instance, I got the Pfizer-BioNTech vaccine, and I'm grateful for it. The problem was when you rely on all new technology, there's a scale problem. As any engineer will tell you, trying to go from a brand new technology when you have to immunize 9 to 12 billion people is just not possible. It doesn't matter what the technology is. There's a learning curve before you could scale it up to that level. And I think that was the deficiency in Operation Warp Speed and other international programs, was not balancing that portfolio with a simple, durable, low-cost vaccine that you could scale for the world now. And that's what we've always done. And what I talked about at the B'nai B'rith event in 2017, we make easy breezy, low-cost vaccines for developing countries, and that included our approach for a COVID vaccine, which checks all of those boxes. And now we expect it to be released for emergency use in India, hopefully this week or next week, and it looks terrific. It uses the same technology as required to make the recombinant hepatitis B vaccine, a Pichia, a yeast fermentation technology. And the difference is that fermentation technology is already in place in Brazil, Indonesia, India, Bangladesh, Vietnam. So you can move very quickly at vaccinating the world. And I think for my frustration was, we weren't really getting the help from the G7 countries because they were all focused on the new technologies. I think if we had gotten even a fraction of the public support, public funds that Pfizer or Moderna got, maybe we could have vaccinated the world by now. But hopefully we'll move pretty quickly. The Indian government has made an advance purchase of 300 million doses. Our collaborators in India, known as Biological E, they're one of the big vaccine producers, have said they've already got 120 million doses made, and they'll move pretty quickly to the 300 million. They have capacity to make 1 billion doses. And now we've also licensed it with no patents, no strings attached to similar vaccine producers in Indonesia and Bangladesh and now Botswana. So hopefully we can move pretty quickly vaccinating the world.
Can you talk for a moment about the politics of vaccine? There was a time when we all lined up for our polio vaccines. I recall it as if it were yesterday. I think I was a first grader getting the Salk vaccine. That was another incredible scientific feat. But what is different here? I mean, the people they worried about their children. We all knew what polio could do, and there was no question. So what is it that's changed?
What's changed, Dan, is we allowed the anti-vaccine movement to grow and become a political movement. So it started around 20 years ago, around false claims that vaccines caused autism, and it started with small non-governmental groups that were um, that were making noise but not having a big impact. But I saw the danger because they were gaining a lot of strength in Texas. And the game changer was in the 2010s, because a number of us in the scientific community were successfully debunking the false autism links. They needed to find a new gig, a new spin, and they did this by aligning themselves with political extremism on the far right, the Republican Tea Party. And that happened here in Texas. They even formed a political action committee, an anti-vaccine PAC that was raising money for candidates in the Texas legislature. And that proved to be very dangerous, because once you start getting far-right PAC money, there's a lot of it around. And so they started to grow in strength in terms of power and funding, and they became a full-on political movement, so that by the time COVID erupted, they had the power to bring in U.S. members of Congress. And you heard it at the CPAC conference, that vaccines are political instruments of control, or first they'll vaccinate you and then they're going to take away your guns and your Bibles. And as ridiculous as that sounds to us, there was enough of the country who believed it. And that's what happened. It became a full-on component, essential element of far right-wing extremism in the United States. And then it got amplified nightly on with the Fox News anchors at night, and as well as some of the other conservative news outlets. And then they even had the ability to recruit their own stable or bullpen of contrarian intellectuals or pseudo-intellectuals, some of them at very prestigious universities like Stanford or Harvard, to tout anti-vaccine views. So now we have a monster in our hands. It's an entire anti-vaccine ecosystem, again with the conservative news outlets, members of the U.S. Congress from the far right, and these contrarian intellectuals, and it's grown out of the U.S. So it's now been exported to Canada. So for the first time, we're hearing those same health freedom, medical freedom sentiments echoed in Canada and Western European capitals. And there's a huge component of anti-Semitism to it as well. A lot of targeting of Jewish scientists and physicians. I mean, I'm regularly sent Nazi symbols and symbols of Nuremberg hangings, and it's meant to intimidate, and it's very successful. So this is very concerning, how far right-wing extremism has strengthened and taken on this anti-Semitic component. So, and this is why I'm so grateful for the support of B'nai B'rith, and I've also been in discussions with the Anti-Defamation League, and how do you deal with this anti-Semitism component as well? And what you see is that it almost looks like some version of Stalin's Jewish doctors plot, right? They go after me, they go after Stan Plotkin, Paul Offit, and we're all Jewish physician scientists committed to making vaccines and developing vaccines. And it's a very dark period that we're going through right now, and we'll have to see how it all goes.
I'd like to, if I could, return to the medicine. Tell us about these new pills, which we're hearing about from Pfizer and Merck, that can be taken after someone contracts COVID. What exactly do they do, and is this a game changer for the possibilities of recuperation?
Well, many of my colleagues feel it's a game changer, including people I'm very close to, like Eric Topol, who's a physician scientist in San Diego, and it may be. I'm less impressed. I see it more as a backstop than as a game changer, and here's the reason why. Antiviral drugs only stop virus replication, which is important. But virus replication with this virus happens in a very small window. It's happening early on in the course of the infection, and then that's followed by a large host inflammatory response. So it's only if you can get treated super early on that it's going to be infected. Basically, you have the first onset of symptoms, you need to get a COVID test, and if you're positive and you take the medicine right away, yes, it can have a substantial impact. But that's not always easy to make that to get the medicines and the pills to fit into that kind of window. So that's going to be the biggest problem, is making certain people can get treated early. The two drugs are not the same. They're both antiviral drugs, but they work by different mechanisms of action. Paxlovid, which appears to be by far the more effective of the two, is the one made by Pfizer. It's a protease inhibitor, and it's very impressive, 89% reduction in severe illness and hospitalization if you take it early on. So I think that's going to be the one. The second one, out of Merck and Company, molnupiravir, has a lot of limitations. First of all, the efficacy seems to be dropping with each larger study, so now it's down to around 30%. And it works by an odd mechanism by introducing virus mutations. So, and because of the concern of what that might have with a growing fetus, for instance, you'll not want to use molnupiravir during pregnancy or in young children. So I don't know how far molnupiravir is going to go. The one from Merck, I think the Paxlovid from Pfizer has got a lot more promise. The question is, how quickly can you make it? I don't think what they're saying is right now, maybe we'll hear more from Biden's remarks on Tuesday, is they only have about 180,000 doses around, which is not enough for this wave. And in time, it'll get more and more scaled. So how much of a game changer Paxlovid's going to be for this new wave of Omicron, it's hard for me to say.
Well, here's a final question. I will not ask you when do you think this will be over, but I will ask you, with the increasing body of knowledge, for example, all through 2020, all through this year, am I making a correct assumption that we are learning more about this virus, and that in turn gives people like yourself, eminent researcher, people who are really working to tackle this terrible virus, more options about how do we deal with it? How do we turn it back? How do we turn this wave back? Is that fair to say that the more we know over these 2 years, the better it is for us really looking forward?
Well, when I take a step back and look at what's happened over the last 2 years, I've been working on a schistosomiasis vaccine for 20 years, right? And it's still in phase 2 trials. And now we have a COVID vaccine that's about to be released for emergency use. So everything has been revved up, because of the urgency. So we've been working day and night. So, to have a COVID vaccine, of course, it builds on our decade-long coronavirus vaccine program. After 2 years, that I'm really thrilled about it, but it's impressive that happened. And now to have an antiviral drug, we have other vaccines and new RNA technology. So no question, the scientific community has responded in a very meaningful way. And between colleagues, we've collaborated like we've never have before. There's really not been any hint of competition or secretiveness. We've put all of our information up on preprint servers like bioRxiv and medRxiv. I'm on Zoom calls every week with Mike Osterholm and Eric Topol and Penny Heaton, Peggy Hamburg, some of the great physician scientists of our time. And the tone is always, we're all scared as hell and we want to help and doing all we can. So I think there are not a lot of silver linings of this pandemic, but one is how I think the scientific community has come together to get these life-saving interventions out in a hurry. But the parallel is also interesting. As much as we've accomplished for science, there's been this commensurate rise in anti-science, and we have this and the politicization of science, and the fact that we have, Dan, since June 1 of this year, 150,000 Americans unvaccinated who lost their lives unnecessarily to COVID is an incredible number. I don't know what you call it. You can't even call it misinformation or disinformation. It's some form of self-immolation. 150,000 people have thrown their lives away because they were defiant of getting vaccines. And just today, for instance, Congresswoman Marjorie Taylor Greene from Georgia, boasted about how they're going to have to hold her down to vaccinate, and tone deaf and are oblivious to the massive and catastrophic losses in human life over this defiance against science. And so for my next book, I'm thinking of writing something along those lines. It's, when I got my MD PhD in New York back in the 80s, I always thought developing new vaccines was something noble or and a contribution to humanity, not thinking that I'd have to gain equal expertise in combating anti-science. But that is our new reality, and it's become part of an authoritarian a form of authoritarian aggression. And I can't emphasize enough the anti-Semitic component to this, and the targeting of Jewish scientists and physicians makes me very concerned. And so, Dan, if you're ever having doubts on why we need a B'nai B'rith, it's more relevant than ever. So thank you for all your great work.
Thank you. I really hope the next time we speak that we will somehow be really close to that moment where this is all behind us. But in the meantime, we're deeply indebted to you, Peter, for all the work that you and your colleagues do. And we appreciate, of course, your friendship to B'nai B'rith over the years. And do look forward to speaking with you the next time.
Absolutely, Dan. And again, thank you all for your leadership and for B'nai B'rith, which has been such an extraordinary organization during this very, very terrible time, for all your great work.
Well, thank you to our special guest, Dr. Peter Hotez.